Hi everyone. So welcome for this webinar. Thank you so much for joining us today for the lecture Biodentine XP New Frontier in Dental Materials to Use in Pediatric and Adult Patients. I'm glad to welcome our KOL, Dr. Professor Yepes, and thank you so much to be here today with us, Dr. Yepes.
Thank you, Aurelie. Thank you, Septodon. I really appreciate that. Very happy to be here. Very.
Thanks a lot. So let me introduce you with just a quick bio. And correct me if I'm wrong, of course. You are a full professor in the Department of Pediatric Dentistry at Indiana University School of Dentistry and an attending at Riley Children's Hospital in Indianapolis, in Indiana, in the US. You are also a clinical professor at the University at Buffalo. You are a dentist and a physician from Javeriana University at Bogota in Colombia. Yeah. You are also board certified by the American Board of Pediatric Dentistry, oral medicine, dental public health as well. You are an active member of the American Academy of Pediatric Dentistry, American Academy of Oral Medicine, American Academy of Oral and Maxillofacial Radiology, Indiana Dental Association, and American Dental Association. You are a fellow in dental surgery from the Royal College of Surgeons in Edinburgh. You are also a member of the editorial board of surgery, oral medicine, oral pathology, and oral radiology. And recently, you were appointed associated editor of the Journal of the American Dental Association. So, Professor Yepes, it's really a great honor to receive you today, and thanks a lot again. Dear attendees, hello everyone. So we are today for around 1 hour and a quarter, made of 55 minutes of lecture. This lecture is recorded. The lecture is in English, and you will have subtitles in Spanish. During the lecture, you will be able to ask questions in the chat box, thanks to the control panel. And then we will have a session of question and answers in live with Professor Yepes. So Professor Yepes will talk today about bioactive materials. He will share his experience of Biodentine XP, especially the wide range of restorative indication in pediatric and adult patients. So basically, if you want to know how to save chair time and make procedure easier for both you and your patient, you are in the right place with Professor Yepes. But first, let's start by asking you some questions to you, the audience. So I will launch 2 polls. Please vote so that we can get to know you better. You can answer directly by clicking on it. And so I hope that everybody is ready. I will start by launching the first questions. Just a moment. So, can you see the first question? I hope so. The first question is, how often do you have a patient presenting a deep cavity in your practice? So you will have you will have 20 seconds to answer every day, quite often, from time to time, and then we will see the results. So please answer. I will close in 10 seconds. I can already see the results. Okay, thank you. I will close the poll. And I will share. So, Professor Yepes, can you see the result? What do you think about? Tell us.
Yes, definitely. if we practice dentistry, Aurelie, and again, thank you so much for your nice introduction. Definitely, if we practice dentistry, we have patients with deep caries pretty much, at least in my practice, every single day. Every single day when I'm in my office, I see patients that, you know, when I'm looking at the teeth, I always will find a big cavity, and then I hope that the webinar will help us to decide what is the best option. But yes, I see this all the time, Aurelie.
Thank you. So I will share another question, and then we will launch the webinar. So the second question, I will launch it right now. So the second question is, which feature is the most important to choose the right restorative material for indirect pulp capping? So please answer. I can see the answer. Thank you. So 10 seconds left, and then I will show you the results. Perfect. Thank you. I will close the poll. We share the result right now with you. So here you have the result. So most of the people have voted for biological properties to choose the right restorative material for indirect pulp capping.
You know, Aurelie, this is a very interesting question. Ideally, it will be perfect if we have a material with all these features: good biological properties, easy to use, the setting time, appropriate setting time, not too long, and then price. So out of these options, the one that the majority answer, the biology or the biological properties. That means that the majority of attendees to the webinar, they prefer a material with biocompatibility. And I kind of agree with that. But we are going to learn that with Biodentine, we can combine the biocompatibility, it is easy to use, and the setting time. I don't want to really discuss the price, but out of the four, we are going to learn the characteristics of Biodentine, and we will see that for sure is bioactive, and that will match 71% of the attendees that they believe that's the most important feature when they pick up a restorative material.
Thanks a lot. So great. In fact, it was a good introduction, a good icebreaker for our lecture. Thanks a lot for your answers. So now I think that we can launch the webinar, and basically we can see you in 55 minutes for the question and answer in live. So thanks a lot, and see you in 55 minutes.
Good afternoon, good morning, good evening. It depends on the time that you are right now, but I'm extremely happy to be here. You will see why in a few minutes. I have been waiting to give this lecture for a long time, and especially for something that I'm going to touch base in a few slides. I want to share an amazing news, something that I, as a clinician, since I'm using Biodentine, I was waiting for Septodon to come with something that will make my life easier, will shorten my chair time, and also will make the things easier for my patients. So I'm very happy to be here, especially again for the news that I have to share in a few minutes, presenting new frontiers in dental materials to the use in the pediatric, and I obviously not just only in the pediatric patient, could be also into the adult patient. And we are going to talk about Biodentine. And we are also, the good news that I have is I want to introduce the new member of the family, Biodentine XP. And just wait, at some point in the webinar, I will tell you a lot more information about Biodentine XP and why, in my opinion, is a great news that is really going to facilitate your job as a clinician and my job as a clinician. So this is me. My name is Juan Yepes. I am a full professor in the Department of Pediatric Dentistry at Indiana University in Indianapolis, Indiana. We are about, if you think about the US map and you want to kind of have a general idea where Indiana is located or Indianapolis is located, we are about 3 hours southeast of Chicago. So we are here, we call this area the Midwest of the US. And I'm a full professor here. My office is at our local children's hospital. And I am a private practitioner. I own 3 offices of private practice, pediatric dentistry, very busy, and we are 4 pediatric dentists, including myself. So I am an academician, and also I'm a very active clinician. And you will see in this lecture that this is a good way to mix my background, because I'm going to share my experience as a clinician, my experience as a dentist working in my office with patients like you, but also I'm going to complement my presentation with my role as a professor. And you will see that at the end of my lecture, because I will give you a brief overview of the literature who is behind supporting Biodentine. So really this lecture is a good way to see my life as a busy clinician and also as a professor. Recently, I was named as the new associate editor of the Journal of the American Dental Association, which is the main dental journal here in the United States. And I'm one of the 3 associate editors. My section in the journal is the section of medicine and dentistry. So that's a wonderful opportunity to review the research, to review articles, and to make sure that we publish really frontline research in different aspects of dentistry. That's a picture of me. You can see with my colleagues here from the Department of Pediatric Dentistry. And maybe you are kind of wondering why this picture is here and why McDonald and Avery Dentistry for the Child is also here in this slide. Well, the reason is McDonald and Avery is probably the most well-known textbook in pediatric dentistry in the world. And I'm one of the associate editors. When I arrived to Indiana University 9 years ago, I never imagined that I will be asked by Dr. Dean, who is the main editor, to be part of the associate editors of this textbook. And that's an honor in my life that every single day when I see the book, I realize that this is an amazing opportunity that really, I enjoy very much to be part of the group of associate editors of the book. So these are our goals for this lecture. Number 1, and this is probably the most critical, understand the indications and the criteria for the use of Biodentine. And as I mentioned before, I have an amazing news, and I will share for the first time Biodentine XP. This is the first time that I'm speaking about Biodentine XP in the pediatric and adolescent patients. And as I probably already said, you can also apply what we are going to describe in this session to the adult patient. At the end of this webinar, I want to correlate the scientific literature evidence of the indications and contraindications of the dentin substitutes, Biodentine and Biodentine XP. This lecture is mainly for the clinician, and I will keep that scope of my lecture. How I apply my BC practice, or how I can use in the BC practice Biodentine and Biodentine XP. So my main goal is the first objective, for you to understand the indications. I think it's important for you. You probably know, but we are going to refresh that. In which clinical situations Biodentine and Biodentine XP is appropriate to use. And we are going to kind of balance the benefits of Biodentine XP when we compare with I don't want to say the old Biodentine, because it sounds like an old material, which is not an old material. But I want to compare the Biodentine XP with the traditional Biodentine that I was using until not too long ago. I need to tell you a disclaimer. This presentation is sponsored by Septodont, and I am a speaker for Septodont, and I feel very proud of that. And I want to deeply thank you, Septodont, for giving the opportunity to work in different educational events, and I really enjoyed that. And this webinar is really the most critical webinar so far that I have been involved with Septodont, because this webinar will come with a new product. And I never had the opportunity to do that. So this is kind of a great opportunity to share my clinical practice and my clinical experience with this new Biodentine XP. The agenda, this webinar is divided in 5 different sections. The first section is I will describe the definition of a bioactive material. So we are all in the same page. Biodentine is bioactive, but I want you to understand why biodentine is bioactive. In these days, you as a clinician, you probably know that when we go to a dental meeting, we walk around the commercial exhibition when all the companies are offering different materials, and it seems like every single company these days claims that they are selling a bioactive material. The reality is not all the materials are really bioactive. So that term bioactive, we need to be very careful, and we need to really understand what is the meaning of bioactive. So I will tell you the latest definition just came about 6 months ago from the International Association of Dentistry. And they got together in September and they came with a definition of bioactive. And I want you to tell me, or I will tell you, if biodentine will match the definition of bioactive, which I can tell you now, yes, will match. Then briefly, I will go over biodentine and Biodentine XP, the composition, what is the main difference between biodentine and Biodentine XP. I know that part, I need to have this part, the formulation. So I will tell you refresh, because you may know the formulation of biodentine, and then in yellow highlighted the indications. And particularly one indication is the one that I want to spend the majority of the time, which is actually the indication that I mostly use in my office, is the use of biodentine as an indirect pulp cap. I use Biodentine XP as an indirect pulp cap pretty much daily, not just only one time. I probably use 2 or 3 times, because as we are going to discuss in a few minutes, using biodentine as an indirect pulp cap is a situation that you face very often in the office. Now, I also will touch base about the use of biodentine for direct pulp cap. Listen, direct pulp cap, which is a situation that, yes, it happens, especially related with trauma, especially if you are a pediatric dentist, because many patients that they experience trauma, they ended up knocking at the door of our offices. So we see patients in trauma, but if you are not a pediatric dentist, you may not see too many patients with trauma, and you may not really have a lot of opportunities to use biodentine as a direct pulp cap. So I will mention that, but I will place a lot of attention to the indirect use of Biodentine XP. And then, as I promised, I will have a brief review of what the literature will tell me about biodentine. When I say brief, believe me, it's a brief review. There are over 1,000 articles in Medline and PubMed published about biodentine in the last 10 years, and or maybe more than 10 years, but it would be ridiculous to have a review of the 1,000 articles. So I'm not going to do that. I need to keep this within the time that they allow me to talk, but I really want to mention 2 or 3 articles that I really believe are critical articles to support biodentine as a bioactive material. So before we start with the definition of bioactive, I just want one slide to just share my own experience with biodentine and the Biodentine XP. I have been using biodentine for about 5 to 6 years. It really, during the pandemic, well, in these days, we cannot say yet that we are completely out of the COVID, but during the really difficult times with the pandemic, was during that time when I really started to use a lot of biodentine, for one reason, because biodentine became my #1 material to avoid the use of aerosols. And during that time, if you remember, during the time of COVID, we collectively, as a dentist, we have a lot of concerns about the use of high speed and low speed and the aerosols and the dissemination of the virus in the room and everything else. So we start to look at other non-restorative, no drilling options for providing restoration. So I started to use a lot of biodentine. I was using biodentine before that, but really during the pandemic was kind of my year that I really start to master the technique, which this is before the new Biodentine XP. And so I learned how to mix and everything else. And I complain to Septodon that you guys need to find a better way to prepare the Biodentine. So that's something that I will share in a minute. And then obviously Biodentine XP is the newest member of the family. And I am after we start to use again high speed and start to create the aerosols again, like we used to do that before the pandemic, I cannot really work without Biodentine. I strongly believe that the clinical application of Biodentine is in my daily life. Let's start with the definition of a bioactive material. I don't want to read this slide. I think so it's you can read it probably better than me, but this is the latest definition of bioactive materials, and it was adopted by the FDI. This is, I believe, in French, Fédération Dentaire Internationale. In English will be the International Federation of Dentistry, which is really the World Association of Dentists. This organization is based on Geneva, and they have the General Assembly in September of 2022, and they came with the definition of what is a bioactive. So the term bioactive should be limited only for those materials that they meet all, listen to this, all 5 of the following criteria. The mechanisms is clearly defined. There is scientifically documented bioactive effect in vitro or in vivo. The duration of the effect is known. Also, antibacterial effects, and I will tell you in a minute why that is highlighted. No significant adverse biological effects. And the prime goal, for instance, to be used to rebuild the form and function of lost tooth substance or lost teeth is not impaired by the material. We will see through this presentation that if I just mark checkpoints and I have my mouse around here, well, okay. But if I go one by one, Biodentine will match all these 5 criteria. So let's go into a little bit more detail about Biodentine. So Biodentine is an active biosilicate technology. Biodentine provides the physical properties of GI as early as 1 hour over time. The properties are almost, I don't want to say the same, but very similar to the sound dentin, and can be placed in both crown and the root without any preliminary conditioning of the mineral tissue. That's saving time comparing with other materials that you need to condition the dentin. Like, for example, we need to condition the dentin when we are going to use GI. With Biodentine, we don't need to do that. The way that Biodentine will have an adhesion with the dentin is very interesting, and I will explain that in a few minutes. So we don't need to use any edge. We don't need to use any conditioning material. Biodentine contains a high purity monomer-free mineral ingredients and is highly biocompatible. At the end of this webinar, when we go into the literature, just wait, I will just introduce you a few articles that they actually do very well, good research to establish if Biodentine is biocompatible or not. So Biodentine, just for now, is not toxic to the pulp cells. Biodentine is a calcium silicate cement that stimulates secondary dentin formation. That's important. It is composed of a powder and a liquid that we mix in the old days before Biodentine XP. The powder used to come in a capsule, and the liquid used to come in a little bottles. I have a couple of pictures later on. So we used to open the capsule and play the 5 drops of the liquid, and then we mix it. And then after we mix it using a titrator, like an amalgamator, and then we open the capsule, and then we collect the material from there, and we pass that to the tooth. So the powder component consists basically 3 calcium silicate, calcium carbonate, calcium oxide, and iron oxide. The liquid is composed by a hydrosoluble polymer and calcium chloride. After mixing, in the old days, using the amalgamator, in the new days, with Biodentine XP, I will show you in a minute, the calcium silicate particles react with water to yield calcium hydroxyl and silicate ions. Now, the resulting, once we mix that, the pH of Biodentine is pretty high. It's an alkaline pH. It's close to 12. very alkaline pH means that it's a highly antimicrobial material. And that is one of the features that match the definition of bioactive according to the FDI. So the pH of Biodentine is close to 12, while the calcium silicate hydrogel polymerized over time. So once this material is polymerized, will form a rigid structure, very rigid. Later, the calcium silicate gel interacts with the phosphate ions in the saliva, listen this, to form apatite deposits that increases the sealing ability of Biodentine. So with time, the calcium silicate gel will actually mix with some phosphate, and the phosphate is present in the saliva, and that union between the silicate gel and the phosphate will actually deposit apatite, and that is going to create a pretty nice seal around the material, so a seal in between the material and the dentin. And that will decrease the leakage, which will guarantee that the restoration will stay. If we look at the cellular level, if I have a microscope to look at the cells, when the cells are in contact with Biodentine, Biodentine promotes pulpa healing by actually increasing the cell proliferation, migration, adhesion, and the expression of some chemokines who are related with that process of cell proliferation of the fibroblast. You can tell now that clearly Biodentine is biocompatible, non-cytotoxic. So Biodentine creates the favorable conditions to keep the pulp vital. That's the reason that we can use Biodentine in direct pulp cap. We don't do that very often, but we can do that, and I use Biodentine more often for indirect pulp cap. Biodentine does a big difference with other bioactive materials who are in the market, and Biodentine stands alone here, not even closer with other bioactive materials. The setting time of Biodentine is remarkable short. It's only 12 minutes starting from the end of the mixing. Other materials who are also bioactive, the setting time is more than an hour. Biodentine is really quick, and we start to count the 12 minutes from the end of the mixing. And as I mentioned before, Biodentine creates a high alkaline environment, and that is antimicrobial. So compare also with other bioactive materials, Biodentine has a higher compression strength, really low porosity, and short setting time. Not to mention that the color stability with Biodentine is much better than the color stability with other bioactive materials. This week, I saw a patient that a different bioactive material was used in a big cavity, and the color stability was really bad. I mean, the color was almost brown. You know, one of the reasons that the parents brought the patient back to the office, I didn't place that material, was because it was looking really brown. And one of the advantages of Biodentine is the color will pretty much stay pretty stable. Why the shorter time, if you want to know, is because the presence of calcium chloride in the liquid and calcium carbonate in the powder. So thank you to calcium chloride and in calcium carbonate is why we have a shorter time. We place Biodentine, we wait 12 minutes. Now I put this question mark because 12 minutes, you know, you can, if you are doing other things, you can keep that, 12 minutes will go quick. You don't need to just wait the 12 minutes. You can go and do other things in the mouth if you need to do other things in the mouth, and I do that often. Okay, I got it so far. I said a lot of good things about Biodentine, the composition and everything. Let's go into the indications, which is really the heart, the main part of my presentation. Let's go with the indications. So I'm going to divide the indications in the crown and the root. I'm not really going to say too many things about the root indications. I'm not an endodontist, so I don't have experience about that, but I have a lot of experience with the crown indications. So we can use Biodentine, and I do this all the time, as a permanent dentin restoration under composite. We can also use Biodentine as a temporary enamel restoration. And it's important to mention that you don't need to take out the Biodentine. You just leave the Biodentine there as a bulk. And using the Biodentine as a bulk material is really the main reason that I use Biodentine daily. Also, the restoration of deep and large coronal caries lesions. We are going to review that as an indirect pulp cap. We can also use biodentine as a restoration of cervical radicular lesions. And finally, we can use biodentine as a pulp cap in pulpotomy. The root indications, yes, I'm not an endodontist. I am board certified here in the US of 3 different dental specialties. One of these dental specialties is pediatric dentistry, but I'm not within these 3 specialties. Endodontics is not one of them. So I really, as a pediatric dentist, I don't do any root repair, root perforation, but I want to mention, so I decide, and I think it's fine that you may sit in there, you do this, and you probably have a much better understanding of the use of biodentine for root indications. And you can read apexification, repair of external resorption, and you can look at that. Okay, let's go and let me tell you a little bit about the old days, because I'm close to tell you the good news of Biodentine XP. But before I tell you the good news, let me show you the old days. So in the old days with Biodentine, as I mentioned, it was a capsule. The capsule will come with a powder, and then you open the capsule, and then you have in a little bottle, you have the liquid, and then you detach 1 single dose of the liquid, you open the little tap, and then you pour 5 drops in the single dose container, you close the capsule, and then you put that in the amalgamator. So please count the time. It was time doing all these things. And then you put that in the amalgamator, and then after 30 seconds, you open the capsule, you check the material consistency. Sometimes, you may need the material a little bit more thicker, so you will need to wait 1 more 30 seconds, and then you collect the biodentine with an instrument. Any instrument really can be used. You can use an amalgam carrier of a spatula, and you put that in the tooth. So that's the capsule with the powder, and then that's the 5 drops that's my fingers putting the 5 drops, or my assistant will do that, and then time, and you have a patient with the mouth open, and also sometimes it was, we have this feeling that, oh my God, I prepared too much, and then I only need 1 tooth, or I prepare a little and it's not enough. So always I was kind of concerned that I mean, it's the same biodentine that XP, but it's a great material, but I don't want to waste if I don't need to waste. And I'm sure the same. You don't want to waste material. And if you work with kids, it's even more critical the time. You want to have something that, in the old days, we use this, and then we will put that in the amalgamator for 30 seconds. Sometimes we need a little bit more than that. Now, biodentine, the new days. So the new days, I just want to introduce Biodentine XP. I was thrilled when I was aware that Biodentine XP was coming, and I knew that probably way before many practitioners around the world will know about Biodentine XP. So, biodentine is the same biodentine, it's the same science, with a whole new experience. And really, my main complaints in the old days with biodentine was the mixing and open the capsule well. That old days are over. Now with Biodentine XP, all in 1 cartridge. So it's a capsule, and the liquid is there, the powder is there. It's an easy placement, so you're just using a gun, a special gun, which is similar to the guns that we use for composites. We go and we do a direct placement, so we avoid, collecting the biodentine for the capsule and transferring the biodentine into the tooth. That happens to me, I'm sure happens to you sometimes. In the transfer, a piece of biodentine will end up in the floor or in the patient napkin or whatever. So with the XP, we have a direct placement, and then good news, now I cannot complain anymore. Well, maybe in the future we'll have more sizes, but now we have 2. We have XP 200 and XP 500, which means that we have 2 different volumes, and we can adapt or we can decide which volume we are going to use depending on the 2 that we are going to work. So this is my new, I would say my new baby. This is my office. This picture is from my office. I use this every day, and this is the biodentine mixer. You can see in the bottom is like a hole. You put the capsule there, you close that, you just twist that, and then you move. I will show you. I think so. I have the slide. Yes. So you put the capsule. This is an XP 500. So you put that capsule in the bottom. You lock that, and then you see this little metal kind of a bar. You push that down, which is basically is going to open the membrane who separates the liquid from the powder inside the capsule, and then you close that acrylic cover, and then, before you need to put the capsule in the upper portion of the mixer. You lock that, close that door, and then you push the button and start, and it's ready to go. You just transfer to the gun, and then with the gun, I will have a couple of pictures later. You can even twist a little bit the tip of the capsule. You can see in this picture, the tip is a little bit bent. I did it, so it's a direct transfer from the mixer to the patient mouth. When we can use biodentine. So let's go with the indications. So the first indication is, I don't want to say this anymore, but this is the most critical indication: biodentine as a bulk. What that means is biodentine in a indirect pulp cap. This is my favorite and more common indication of biodentine XP in my practice. I use biodentine XP, and this is the most common indication. So this is the clinical situation. So I want you to imagine, close your eyes, and imagine that you are in the office and you have this patient, and you can see that it's a large caries lesion. The patient is asymptomatic, and no spontaneous pain, no having pain in the middle of the night, no having pain eating. And then you take a radiograph, and then you don't see any radiographic signs or radiographic changes that indicate any pathology, because no matter what you do in dentistry, we need to have a diagnosis. So before we do an indirect pulp cap, we need to have a diagnosis, because obviously we are not going to do an indirect pulp cap in a tooth with irreversible pulpitis. So if the patient is having a spontaneous pain, or you take a radiograph and you see a periapical lesion that indicates that that pulp is maybe dead, well, we don't do an indirect pulp cap. So we need to have clear the indications. So assuming this is the clinical situation, the patient is not having any pain, or maybe, if you want to kind of add a little bit of pain, maybe once a while, no spontaneous, maybe the patient eating will have some discomfort. So this is the situation. So what we are going to do in this situation is we are going to do an indirect pulp cap. Why is important to learn that? Because we want to avoid exposure. We want to expose the pulp. We don't want that. We want to leave some dentin, and we want to place a highly biocompatible material over the dentin. So we don't keep going down, because I promise you, if you keep going down and down and down and down until finally you will see a red mark, which is, hello, welcome to the pulp. So this is the indirect pulp cap. So as I mentioned, it's critical to assess the pulp vitality. So we need to have a diagnosis. So this is the main indication of biodentine XP. It's a tooth with a deep caries lesion very close to the pulp, but without signs and symptoms of pulp degeneration. Then what we are going to do is the caries around, we are going to leave the caries to avoid the pulp exposure. So we need to remove some. You can do that with low speed. You can do that with a big round burr. Sometimes I do that with hand instruments. Honestly, I prefer, and again, you are listening to this and you like to get some tips, and I prefer to use low speed with a big round burr. I prefer to do that. Sometimes I feel that when we use the hand instrument, it's easy to kind of take a big chunk, even if I don't want to take a big portion of the dentin, and without really want to do that, we ended up exposing the pulp. So I want to just go slowly with high speed and a round burr. And then we place biodentine XP, is placed over the remaining caries dentin to stimulate healing and repair. And as I mentioned, biodentine will, once the biodentine interacts with the saliva, that will help to create an amazing seal. So 3 steps: isolation. You can do the isolation in different ways. Whatever you feel more comfortable, you remove the caries lesion, you prepare the biodentine XP, which is obviously a lot quicker, more convenient than the old way to prepare biodentine. We place the biodentine directly into the floor of that caries lesion without really exposing the pulp. We wait for the 12 minutes, and then we perform 2 options. We can perform immediate restoration, so we can place a composite, we can place an amalgam over the biodentine, because the biodentine actually will be my bulk, will be the material who is going to fill that cavity. Or we can do something not immediately, and we can just leave biodentine for some time, that you can just leave biodentine there until later on you decide to do a final restoration. With the good news is, if you decide to do a non-immediate restoration and you wait 2 or 3 months and 2 or 3 months pass and it's time to do the definite restoration, you don't need to remove biodentine. Actually, you need to leave the biodentine there. So this is the immediate enamel dentin restoration. You place the biodentine XP, you wait until the end of the setting time, and then you place the permanent restoration, the composite of the amalgam. Or you can place a stainless steel crown. You don't need to remove the biodentine. And biodentine, good news, is compatible with all different types of bonding systems. So you can edge bond over the biodentine, and then you can put your composite. But that bulk material is biodentine. So this is actually the same example. I just went with around low speed. I remove a little bit of the decay, not completely, place biodentine, and then over biodentine, I place my final restoration, which is a stainless steel crown. That will be one more example. We have a large caries lesion. You can see that on the radiograph. In this example, you know, a hand instrument is used. Again, I prefer to use round burr, but that's your own preference. If you feel more comfortable using a hand instrument, that's fine. And then we leave some, assuming that you don't have any radiographic sign that indicate that the tooth is having an irreversible pulpitis or is having necrosis, and that's the case here. And then you just place your biodentine XP as the bulk material, and then over the biodentine XP, you can go ahead and place an amalgam. I still, my personal opinion, I still using amalgams in my practice. This is also a case, a patient from my practice. This is a permanent molar, a lower permanent molar, that you can see that there is a caries lesion in buccal. I know that the position of the picture is kind of weird, but it was the only way, and also I forgot to dry, you know, but it was the only way to take the picture because I really want to show that the decay is buccal, and you can see around that buccal that kind of a halo of a little bit more dark. Well, it was a big cavity. So I open it up and I start to use a round burr. I realized, oh my God, this is deeper than I thought. Patient was asymptomatic, no radiographic signs that indicate any pathology. So I decide, okay, this is a good example of doing an indirect pulp cap, and I'm going to use biodentine. So I use the capsule, and I place the capsule in the bottom, lock it, and then, as I mentioned, that bar, I just push down the bar, and that will break the membrane who separates the powder from the liquid. And then I didn't explain this very well in the previous slide, but you can see that here in the picture. I unlock the capsule, and then I put the capsule in the upper place. And again, I need to lock that, and I close the door of the mixer, and then that's it. And then I place that in the gun. And remember, we have the XP, we have 200 and 500, depending on the amount of biodentine that we needed. And in the picture on the right side, the tip is not yet bent. I was supposed to do that before I took the picture, but I was so excited, so I didn't do that. But you can bend the picture so you transfer directly the biodentine XP into the preparation. And then you can use a Q-tip, or you can use, you know, whatever instrument you wanted to try to not leave any bubbles within the material, and to try to make sure that it's even distributed within the cavity. You don't want to leave some parts with just a little biodentine. You want to be sure that it's even in the cavity. So that's what we did it. In the picture on the left side, we make sure that it's even distributed, the biodentine. This is just 1 second after I place the biodentine. And then I wait the 12 minutes. Then after that, I edge, bond, and I ended up putting the final restoration. So with the new biodentine XP, it really, I'm trying to think in terms of time, how much time we save is we save a good amount of time. I would say probably 10 to 15 minutes, you know, because I know the process of opening the capsule, putting the drops, mixing that, putting it in the amalgamator, and then transferring it into the cavity, no having any control over the amount of biodentine that we needed. With the biodentine XP, you have a control over that, so we use what you really needed. This is one more example. This is pure pediatric dentistry. I love it. I love this example. This is a patient of mine. This is from my office. Mom is fully aware that I'm using the pictures for a educational webinar. So I told Mom, can I take a pictures? And Mom said, yes, Dr. J, you can take the pictures. So this is a baby molar. Actually, this is a maxillary baby first molar with a large caries lesion. Now, before, obviously, I took a radiograph, no radiographic changes, and the patient was not having any pain, no spontaneous pain, no pain in the middle of the night, no swelling, nothing. So I said, well, here we go. One more great indication for Biodentine XP. The picture in the middle, I just went with a round burr and I removed a little bit of the infected dentin, and then I placed the Biodentine over that. So that is a great example of an indirect pulp cap. And then after I place the Biodentine XP, I place a stainless steel crown. So I provide a definite restoration, and I can guarantee that this is actually going to work absolutely fantastic. I just want to show you, this is not the time yet for the article. The time for the articles is coming in a minute, but this is just an article to look at the, evaluate and compare in vitro the effect of the overlying materials, the composite of the amalgam on the setting time of the Biodentine. And the conclusion is, you can just jump into the conclusion. This was published in Pediatric Dentistry, which is the main journal in the specialty of pediatric dentistry. Overlying materials showed no effect on the Biodentine final set. So whatever you use, if you use composite or if you use amalgam, that is really not going to change the setting final or affecting the setting time of Biodentine. This is also one article that is appropriate for this section, is to evaluate the clinical and radiographic outcomes of Biodentine substitute as an indirect pulp cap material for primary teeth. That's exactly the patient that I show you in a few slides. So the conclusion of this article is combined clinical and radiographic success rates for Biodentine is close to 98%. That is absolutely fantastic. Now, we can also use Biodentine for non-immediate enamel restorations. I did a lot of this during COVID, which is, I will use, Biodentine. At that time, I didn't have Biodentine XP, so I will use Biodentine in big cavities, and that will be my dentin, my bulk dentin into that cavity. And I will kind of model the surface of the restoration, wait until the end of the setting time. Again, we check occlusion. We use an articular paper, make sure there is no hard contact, and then we tell the patient, that's it. Within 1 week, up to 6 months, we can complete that. And then the remaining Biodentine can be just leave it there, because that is artificial dentin. So you don't need to remove it. That's artificial dentin. In these days, this option, I need to say, I don't do a lot. I prefer to do immediate restorations. I prefer to just place the amalgam of my composite. That will be the example. In the old days, you have that big, look at the size of the cavity and the decay, all the demineralization in that front incisor tooth. So I will use a little bit of the hand excavator, and then I will place Biodentine, and I will leave it. I can leave it up to 6 months, and then at some point I can do the final composite, but I don't need to remove the Biodentine. My Biodentine now is my dentin. And the other indication that I want to briefly touch base is the direct pulp cap. I don't do this very often in my office. You can imagine, probably you sitting there watching this webinar, you don't do direct pulp cap daily. If you are a pediatric dentist, a little bit more than a general dentist. So direct pulp cap is when a pinpoint mechanical exposure of the pulp is encountered following a traumatic injury, and then Biodentine XP can be placed in contact directly with the pulp. That's a direct pulp cap. You do the isolation, you get your hemostasis of the pulp, then you prepare the Biodentine, and then you place Biodentine XP directly into the exposed pulp. And then you I suggest to perform an immediate restoration. So you place your composites. And I have one example here. This patient came here, hit that front tooth, you can see it. That's clearly, you can see the pulp. So that's a complicated crown fracture. And then you follow the steps, you clean that, you isolate using a rubber dam. And then after you clean that, you put Biodentine directly in contact. Listen to this, directly in contact with the pulp. Biodentine is highly compatible. Actually, it's going to do extremely well when Biodentine is in front of the fibroblast and the cells of the pulp. And then after that, you do your final restoration. In this case, the final restoration is a composite. So that will be the direct pulp cap. And also in pulpotomies, a pulpotomy is also a direct pulp cap. We do pulpotomies in primary teeth. In some situations, we do pulpotomies in permanent teeth. It's extensive caries. We remove the pulp in the pulp chamber. That's a pulpotomy. We do that with a round burr. We clean up the pulp from the pulp chamber. We achieve hemostasis. If we have 2 walls, or we have more than one wall missing, we use a matrix around the tooth, and then we place Biodentine directly into the pulp chamber filling up the pulp chamber almost like a bulk material. And then we wait for 12 minutes and then we place over. I highly suggest that if you are doing a pulpotomy, you place a stainless steel crown over the biodentine. That would be the example. So this is a tooth who is ready for a pulpotomy. You can see in this picture that the pulp from the pulp chamber is removed, and you are going to place biodentine in direct contact with the pulp horns. And you fill that cavity. In this particular situation, you need to place a band. So you make sure that you keep the biodentine within. You don't want to place biodentine everywhere. And then after that, in this situation, there is no option in my mind that placing a stainless steel crown. So I highly suggest to place a crown in after you do a pulpotomy. And biodentine, actually, when I start to use biodentine, I believe the first time that I used biodentine was as a pulpotomy material. Then I kind of quick learned to use biodentine as a material for indirect pulp caps. But initially, I started to use biodentine as a direct pulp cap. So the old days, mixing that, you can see that the capsule, after you remove the capsule from the mixer, and then you collect the material, and then you place that over the cavity. You remove the band, and then you place your crown. Very good. So now let's go into the last part of my webinar. I hope that so far you got the main points. I think so. One of the main points is to tell you the good news about Biodentine XP. I was very excited when Septodon told me about the Biodentine XP. I keep a good relation with Septodon, and it was so cool when they told me, we have a surprise for you, Dr. J. We have, Dr. Yepes, we have what you are looking for. So it's time now it will take me about 7 minutes, so 7 to 10 minutes. I just want to show you a little bit more about the articles who are really the backbone of my presentation, because it's easy for me to just say biodentine is highly compatible, but I want to not just only listen from me, I want also you to be aware that there are plenty of articles who actually support that sentence of biodentine as a bioactive material. So since biodentine is available, there are over 1,000 articles. Biodentine belongs to the generation 3 bioactive materials. We start to see biodentine since I would say probably 2009, 2010. So biodentine has been around for a long time. So how about biocompatibility? So this is a very well-designed study about the influence of biodentine on the collagen type 1. Collagen type 1 is the main collagen in the pulp, in the dental pulp. And the collagen type 1 is actually produced by the fibroblast. Place biodentine in the presence of fibroblast. And it's a great interest to investigate that. And the conclusion was the authors, they look at the proliferation, cell morphology, cell viability, and they look at that when they place biodentine with the fibroblast, and none of the biodentine suspensions influence the cell morphology, proliferation of cell integrity. That cannot be more bioactive and more biocompatible. So really, the fibroblasts survive without any problem. It was a slow decrease, only 5% in the culture. Remember, this is an in vitro study, but still an excellent results. 95% of the fibroblasts, they actually love it, biodentine. If you are sitting and you really want to read a good, a little bit extensive, but this is obviously, this is a systematic review, which is the highest evidence that we can get about any topic in dentistry. And this is a systematic review published by the European Academy of Pediatric Dentistry in 2018, just before COVID, about the clinical applications and the material features, a 3-year lead review and update. So this is, and that's the reason that is there, because I highly recommend it if you are a teacher or you want to give a lecture, or you want just by yourself, you want to learn more about biodentine, please, this will be my #1 recommendation for you to look. And that will give you a lot more information than this webinar about biodentine. So we know the composition of biodentine. And coming from this systematic review, the initial setting time, this is probably the number 10, 10 times that I say 12 minutes. However, this study showed that, or one of the studies that they reviewed showed that saliva and blood, they can increase the setting time. I don't really care for how long we'll be increasing the setting time. I think so the take-home message for you and from me is we need to, as much as we can, we need to try to work in an environment without saliva and without blood. The radiopacity, compared with other bioactive materials, the radiopacity of biodentine is less, but there is a good reason for that, and I will tell you why. I prefer to have lower radiopacity comparing with other bioactive materials because the reason is coming in a different slide in a few minutes. Biodentine and other bioactive materials, they generate fewer artifacts than amalgams. Color stability is great. Biodentine maintains the color stability after 6 months and exhibit less decoloration compared with other bioactive materials. How about porosity? Biodentine has a lower average pore diameter, so it's a small, really small pores. The porosity is also less, and there is a higher bulk density compared with other bioactive materials like MTA. The compressive strength of biodentine is higher than other bioactive materials like MTA. The acid etching procedures, because I mentioned that you place composite over biodentine when you are doing an indirect pulp cap, that actually doesn't affect the compressive strength of biodentine. So biodentine exhibits higher hardness, flexural strength, and elastic modulus than other bioactive materials. The increased solubility of biodentine has been attributed to the use of water-soluble polycarboxylate in the liquid component. Biodentine has the ability to release calcium, and biodentine releases significantly more calcium than other bioactive materials like MTA. And that increase in the release of calcium is because the presence of pure tricalcium silicates, calcium chloride, and a high solubility of biodentine. I mentioned the micro leakage. The micro leakage of biodentines is remarkable good. Not just only remarkable good, and it's also very stable over time. There is a better adhesion of biodentine to the dentin, and this is what I promised in a previous slide, the why. I'm sorry. The why is because the physical process of the crystal growth within the biodentine, that crystal growth will be within the dentinal tubules. So at the end of the day, biodentine will have a micromechanical bonding with the dentin, thank you to that growth of the crystals within the dentinal tubules. So that will create a better adhesion of biodentine than other bioactive materials. And remember, no conditioner to the dentin, so you don't need to use conditioner. Antimicrobial activity, remarkable high, is critical in the definition of bioactive. Biodentine is an antibacterial. It's very strong against mutants, against sanguis, and also against some fungal like Candida. And that is because the high pH, which is close to 12. Biodentine exhibits a capacity to induce odontoblasts, which is the main cell in the dentin, to differentiate into human dental pulp stem cells. It cannot be more bioactive, really, when you look at that. Biodentine increases the phosphorylation of extracellular signal kinase, and also biodentine induces the upregulation of the osteocalcin and the dentin matrix. And at the end of the day, biodentine, as well as other bioactive materials, they stimulate the expression of angiogenic genes, which means more angiogenesis, and angiogenesis means more blood supply to the tissues. Cytotoxicity. Stem cells from the apical papilla in contact with biodentine, they don't die. They exhibit actually increased cell viability. And we have a better results in terms of cell survival and proliferation of periodontal ligament cells than other bioactive materials. You can see, I forgot to mention at the end of all my slides, there is the reference. So you can go and check the reference and you can look if you want to get more details. I will be more than happy. At the beginning of my webinar was my email. I will be more than happy to share any of this information. Now, the presence of the less toxic radiopacifier. Remember, biodentine is actually less radiopaque than other bioactive materials. Why? Well, that is because there is less toxic radiopacifier, which is zirconium oxide. And that's probably the reason of the better cell survival. So it's a little bit less radiopaque than other bioactive materials, but is more friendly with the cells. Oops. This is a very dense article about the effect of the biodentine in the bone. You can read it. The conclusion is Biodentine performs excellent in front of the bone cells. And they look, in this article, they look at different capping materials when they are placed in front of when the cells of the pulp are placed in front of different materials. And all show it different cytotoxicity. They compare MTA, calcium hydroxide, and biodentine. And the better cyto or compatibility was biodentine. The setting reaction and the bioactivity of biodentine. We are getting to the end of this amazing webinar, so hold with me. I'm getting to the end time that they allow me. I can talk for hours about biodentine, and that sometimes could be a problem. So biodentine sets with a hydration reaction. In the old days, we use the titration using an amalgamator. In these days, we have the amazing bioactive Biodentine XP. So the calcium release promotes apatite formation, and that's one of the main features of biodentine. The calcium triggers the differentiation potential of the dental pulp cells and facilitates mineralization, leading to the formation of a strong dentinal bridge. The dentin bridge that is formed when we use biodentine as a direct pulp cap is much thicker than the dentin bridge that is formed using other bioactive materials, or in general using other materials. Biodentine has been reported to release significantly higher levels of calcium in calcium hydroxide cements. Increase of the pH, thank you to the calcium, is actually antimicrobial, as was discussed before. Very alkaline environment. And this is my last slide, the biodentine tooth interface. I already mentioned pretty much everything. We don't need to do previous etch. We don't need to use previous bonding. The adhesion of biodentine to the dentin may result from the physical process, I mentioned that as well, of the crystal growth within the dentinal tubules. Different studies show that biodentine is able to enrich the adjacent dentin area with significant amounts of calciums that they are essential for the remineralization process. And finally, electronic microscopy study shows a great affinity of biodentine to exchange ions with the tooth substrates and to bond chemically with the dentin. Well, this is the end slide. I want to say thank you. As I mentioned, it is an honor for me to really introduce you to the new member of the family, Biodentine XP. I use Biodentine XP today. I used it yesterday, and I will use Biodentine next week. At the end, the benefit is for my patients, that they are getting a high quality material, high bioactive, high biocompatible. And also, you know, Septodont really thought about us as a dental professionals to try to help us a little bit. And I think so with the Biodentine XP, they are helping us a lot more than a little bit to make our lives a lot easier. Thank you so much. Again, my name is Juan Yepes. It has been a pleasure to be the speaker for this webinar. It has been my pleasure to introduce Biodentine XP. And I hope that you learned something. And I hope that at some point I will be able to see you face to face and you are going to shake my hands and say, Dr. Yepes, I have the opportunity to listen to your webinar. I love it. And now I'm using Biodentine, which, believe me, you will love it. Thank you so much and have a wonderful, wonderful rest of your day if it's morning, or wonderful night if you are ready to go bed. Thank you so much.
Professor Yepes, for your highly illustrated lecture. Thank you so much. Thank you so much. It was very interesting to see your experience as a clinician and as an academician as well. So really, thank you so much for that. We had a lot of questions for you. So let's start. If it's okay for you, Dr. Yepes.
Yes, absolutely. I am ready for the questions.
Okay, perfect. So let's start. Many questions. So let's see the question. So the first question, Professor Yepes, does biodentine can be used for pulpotomies as well in permanent teeth?
Well, yes, absolutely. We can use biodentine in adult and in primary teeth, and we can do pulpotomies in the primary dentition, and we can do pulpotomies in the permanent dentition. it's not really the main topic of this webinar, but you know, the indications of pulpotomies in permanent teeth are a little bit more narrow than the indications of pulpotomies in primary teeth. But that's okay. I don't want to really go in more details, the differences, but I think so. If the permanent tooth is candidate for pulpotomy, that means that you have a diagnosis, and the diagnosis allow you to do a pulpotomy. Like, for example, if you have some radiographic signs that indicate pulp compromise, that tooth, that permanent tooth is not an indication for pulpotomy. But I will stop here, and I will just close the answer to your question, Aurelie. Yes, biodentine can be used in pulpotomies. It doesn't matter if it's an adult or a baby tooth, you can do it. But it's always critical, as you probably know as well as me, that it is critical to have the correct diagnosis before we use biodentine. Like everything in dentistry, we need to have a diagnosis before we move into the next step.
Okay, thank you, Professor. Then we have several questions regarding caries removal. How much caries can we leave behind? I mean, affected dentin and infected dentin. What are your recommendations regarding?
Yeah, that's an excellent question, and I want to guess the age of the dentist who sent that question. I'm not going to really, but I know that, you know, my days in dental school, the idea was if you are in front of a tooth with decay, you need to remove the entire decay until you find healthy dentin. That was the paradigm for many, many years. I remember when I was in dental school, my teachers, they will tell me that if you are going to remove decay, you need to remove completely the decay, even if you expose the pulp. So what happened in that days, in the 90s and early 2000s, is we exposed many, many pulps because the idea was, okay, I need to remove until I find sound dentin. Now, in these days, we move forward and we know much better. We have better materials like biodentine. So doing an indirect pulp cap is indicated, assuming that you have a good diagnosis. You really, you know, going back to the question, the amount of dentin that you need to remove, it depends. Each situation is different. But I will tell you something from my heart. As a clinician, the idea is don't remove too much. Just remove a little. You don't really need to remove too much, because if you start to remove too much, then you will may end up exposing the pulp. I think so. And we don't have a microscope in our eyes. I know some of you may work with microscopes, but you know, I will remove a couple of millimeters, but I very careful will avoid as much as I can to continue removing the dentin, because if I do that, then I will expose the pulp. And then if I expose the pulp, it's a completely different game, because now we don't do direct pulp caps in caries exposures. We don't do that. So then you will need to move into the pulpotomy. So I know for the person who answered this question, I wish I have an answer of, okay, 2 millimeters or 3 millimeters or 4 millimeters. I think so. Each situation is different. And I don't know how many times I talk with Aurelie and I talk with the colleagues about the same question, how many millimeters you need to remove. And I don't think so nobody will tell you exactly how many millimeters. You remove a little bit. In fact, you know what? You probably don't need to remove the decay. You probably don't need to do that. If you get a good seal and you use biodentine, which is a high biocompatible material, is going to help you to remineralize the dentin, then you probably don't need to do it. But I think so the bottom line is don't do it a lot, don't remove a lot so you don't expose the pulp. I know it's a long answer, but.
Thank you. Would you put any liquid disinfection before applying biodentine on a pulp exposure?
Yeah, that's a good question as well. Very to the point. You can do that. Sometimes personally, this is my, and I am not a super clinician. I am just a faculty and I see patients like you. So don't take my words as evidence-based dentistry, obviously. And but if you want me to answer that question based on my experience and based what I know about biodentine, yes, you can. In these days, sometimes when it's a deep cavity, I use silver diamine. And as you know, silver diamine is pretty much medication that we are using these days to kill the bacteria. So you can use biodentine, you can use silver diamine, and then over silver diamine, you can place biodentine. And we refer that as the smear technique, that we use silver diamine and then we place biodentine. And that's a very nice combination of two excellent materials. The silver diamine is an antimicrobiological material, as well as biodentine. They have a very high pH, very alkaline pH. And then over the silver diamine, you place biodentine. You can do that. So yes, you can use disinfecting material before placing biodentine.
Okay. One question regarding Biodentine XP: how to ensure the right consistency each time?
That's a good question. With Biodentine XP, you really don't. I have a lot of more issues with the old days of Biodentine, the days that we used to put the drops and then put that in the amalgamator. I will tell you, Aurelie knows sometimes the consistency was not very constant. In other words, sometimes will be a little bit more liquid, a little bit more. So it was a whole range of, sometimes to the point that I started to kind of guess, sometimes 4 drops, 5 drops. But I will tell you, with Biodentine XP, you don't have that issue. You don't, because the liquid and the powder are already in the capsule. You just put together the liquid and the powder, and then you put that in the titrator. So the consistency with Biodentine XP is very, very, very fixed. Almost, you get always the same consistency.
Perfect. And I think we will take the last question. Is it possible to apply Biodentine and Biodentine XP as a bulk material?
As a what, Aurelie? I'm sorry?
As a bulk material.
As a bare material? As a
bulk material, I mean...
permanent material. I cannot hear you.
As a bulk material, I mean, for example, if the pulp is exposed from the pulp to the top of the cavity.
Yes, you can do that, of course. Yes, absolutely. Absolutely. Yes, you can do that. I do that all the time. Yes. Aurelie, I started to use Biodentine before I met with you, way before I met with you. And I went through, at the beginning, I was using Biodentine maybe a few times per week, maybe a few times per month, almost like the question that you asked at the beginning. And then slowly I start to realize that, the indications, I start to understand the different indications of Biodentine. And then as a pediatric dentist, as a dentist working with adolescents and with children, I start to be a heavy user of Biodentine, and especially in cases of indirect pulp cap. And I hope that the webinar was enough clear to explain that the indication of indirect pulp cap is, in my opinion, probably one of the most critical indications of Biodentine. Is the situation when you have a deep caries lesion, the patient is asymptomatic, you don't have radiographic signs that indicate that the pulp is dead, the patient is not having a spontaneous pain. That's the perfect situation to place Biodentine. It's a true dentin substitute. And also Biodentine is a true bioactive material. I just came back, Aurelie, for 3 different dental meetings. I told you that a few minutes ago before we went into the meeting. And walking in the commercial floor, there is a lot of companies that they claim, oh, my material is bioactive, my material is bioactive, my material is bioactive. But if you really remember the slide with the bioactive definition, few materials will meet the criteria of bioactive. And no question, Biodentine is one of the bioactive materials. So we are in the new age, new era. It's almost like artificial intelligence. You like it or not like it, it's around us. So the new bioactive materials, and by the way, Biodentine is not too new, but in these days now, we dentists, we are realizing that we have excellent materials that really change the paradigms of the way that we approach the treatment of our patients. So I really want to thank you, Aurelie. I want to thank you, everybody. I cannot be more humble to have my colleagues listen my webinars. And if you have any other questions, you can reach me to my email, or you can, there is plenty of information in the Biodentine website. You go to Septodont, and then there is absolutely plenty of information if you want to know more articles and cases and a lot of information that I will invite you to go to the Septodont website and then look at the link to Biodentine, and then you will see everything that you want to know about Biodentine XP. Thank you so much, and I really appreciate Aurélie. I appreciate you so much as my friend, and everybody else, thank you so much.
Thanks a lot, Professor Yepes. Thank you everyone as well for attending this session. Thank you also for your question. I hope this webinar has been interesting to everyone. I hope so. You will receive as well the replay by email. And if you have any question, of course, feel free to keep in touch with us. Yes, thank you. Stay tuned for the next webinars. There will be also a short survey when you will close the window. So please take time, please answer, and it will help us to improve also our next sessions of webinar. Thanks a lot. Thank you, everyone, and bye-bye.